Good morning, everyone. At this time, I'd like to turn the press conference over to Health Director Gibby Harris. Gibby.
Thank you, Bill. Good morning, everyone. Thank you for joining us this morning. I'm here with Dr. Meg Sullivan, our Medical Director for Public Health. We both have brief updates for you, and then we'll be happy to take any questions that you might have. Just briefly, our metrics continue to at least have stabilized at a much lower level than we saw in January. We continue to see some slight improvements. I want to point out, though, that there are several different things that will impact whether we continue to move in that direction or not. Obviously, the number of people we have vaccinated will definitely make a difference as we move forward. It will take some time, but as vaccines become more available, we're hoping that people take advantage of that and access those vaccines. We know that we can continue to have some issues with disparities in our community around vaccine, as well as issues around hesitancy. We're doing everything we can to help people feel comfortable with the vaccine and hopefully make those appointments. As we see more reopening in our community, we do know that that will have an impact as well on the amount of virus in our community. And we're hoping that people will continue to do the things they need to do to keep that situation from becoming an issue for us here in Mecklenburg County. We know that there are variants out there. We're watching what's happening in Europe. There's questions about some other states that are seeing increases and spikes in the number of cases and whether variants are responsible for that. So again, that's another issue that we're watching carefully. And then, of course, spring break is upon us, and we know that that is going to have some potential impact if it's consistent with what we saw over the holidays, and so we're a bit concerned about that. So as I speak about those things, there's a couple of things that we need to stay focused on in our community. Number one, we need to continue with the prevention measures that we have been working on from the beginning. The main one, it appears, based on recent studies, is masking. People need to continue to wear their masks when they go outside of their homes, in every setting outside of their homes, and they need to make sure that they're wearing masks that fit well and that they're wearing them appropriately. We also need people, as I mentioned, as we go into spring break, that people are smart and intentional and use good common sense to make decisions about how to engage with others in our community and whether to travel. Traveling does present additional increase of risk of exposure to individuals while they're away, but it also brings that back to our community, and we want people to be aware that that is something they need to be paying attention to and be focused on. So we will be releasing some specific recommendations around spring break that are consistent with the guidance that we're receiving from the CDC. But specifically around travel, the CDC continues to recommend that if you're going to travel, that you get tested before you go, and that you check for the travel restrictions in the area that you're going to before you go. They may require you to be tested ahead of time before you get there, or make you quarantine once you get there. So you need to check those travel restrictions. When you go traveling or even out in our community, as we mentioned, those public health prevention measures, masking, social distancing, those things continue to be very important. And when you return from a trip, you need to get tested on return within 3 to 5 days of return, and stay at home for 7 days following that travel. And if you don't get tested, you need to stay at home for 10 days following that travel. Now, we know that the guidance changes as we get into more people being vaccinated, fully vaccinated. So this is travel recommendations and guidance specifically from CDC that has been in place for some time, has not been changed, and we need people to pay close attention to that. And I do want to mention that, as I mentioned earlier, that we are going to be seeing increased availability of vaccine over the next couple of weeks as we move into April. We continue to work with our partners in community to build capacity to make sure that vaccines are readily accessible to individuals in our community, but we do know that only not quite 15% of our population is currently vaccinated. And that is a number that we need to pay attention to. we've got a long way to go to have enough people vaccinated to make individuals feel comfortable to go out in public. And so we need you to continue to pay attention to those things that are important and to be part of the solution with us so that we can see those numbers continuing to come down and so that we can continue to open things up safely in our community and prioritize those things like our children in school and making sure that those environments are safe, because our children cannot be vaccinated at this point. They don't have that option. So we need others to be vaccinated to protect our children. So with that, I'm going to turn it over to Dr. Sullivan to specifically talk about some of our vaccination efforts.
Thank you, Gibby, and good morning, everyone. So as a brief update for vaccines from Mecklenburg County Public Health, as of Tuesday, we had administered over 56,000 doses of the COVID vaccine, including over 36,000 first doses. Our immunization team continues to be extremely busy over the past several days as we work to get vaccine out as quickly and equitably as possible to eligible individuals in groups 1, groups 2, groups 3, and now as of yesterday, March 17th, group 4 individuals with specific high-risk conditions or living in specific congregate settings. We continue to ask individuals to attest to their ability or to their eligibility for each group and do not require specific medical documentation or specific ID requirement to receive a vaccine. Highlights from our events over the past week include events with the Latin Coalition, with Smith Family Wellness, with the Camino Center, with Mecklenburg County Courts, the Optimist Hall, and Mecklenburg County Sheriff's Office. We also continue to work with our community partners and our vaccine event request list to plan future community events in multiple locations throughout the county, again, with a focus on those prioritized populations with our vaccine equity plan. So aim to assist with our equitable distribution of vaccine. As I mentioned last week, and as Gibby briefly mentioned earlier, we also continue to spend significant time conducting outreach to the growing number of enrolled vaccine providers in the community as part of this vaccine equity plan, an effort to ensure access to the vaccine throughout the entire community. Again, this week, we received additional vaccine supply and have been working hard to transfer vaccine to multiple locations, including several community pharmacies and clinics in multiple zip codes throughout the county. We also continue to collaborate closely with our hospitals and emergency management partners to discuss ongoing vaccine distribution in the community, especially as we prepare for increased supply of the vaccine coming into our county. And as a quick update on our homebound vaccine initiative, we have received over 300 requests, and the team has been reviewing these requests and making plans to begin administering vaccines likely in early to mid-April, depending on the supply of the Johnson & Johnson vaccine that we receive. Just as a reminder, we do now have a vaccine request form on our website, which is specifically for Mecklenburg County residents who are currently living homebound due to physical or mental disability and unable to travel to a COVID-19 vaccine clinic. Residents may also call our hotline at 980-314-9400, option 3 for English, option 8 for Spanish, to complete the request form via phone. We are also engaging with our community partners to identify vulnerable individuals and groups in the community who have not yet been vaccinated to develop plans around how best to ensure they have access to the vaccine. Those are all my updates for the day.
Thank you, Dr. Sullivan. First question today is Vanessa Ruffes, WCNC.
Hi, good morning, everyone. I wanted to see if y'all had any concerns with drop-offs in testing levels. I know that some of that could be related to just lack of demand. People aren't seeing symptoms like they were over the holiday peak, but is there also maybe a concern that people think because they're starting to get vaccinated, they don't have to be tested?
And thank you for that question. I think that's one point that we want to emphasize is that testing is still very important, and it really will help us continue to restrict the amount of exposure that people have in the community. So we're working with our partners to make sure that testing continues to be readily available and to encourage anybody, whether they have symptoms or not, if they believe they have potentially been exposed or have been involved in some large or even medium-sized gathering, that they consider being tested. We think that's critically important as we move forward. So I think the drop-off, some of the drop-off has been related to the fact that we came out of the holiday season where everybody was trying to get tested before they went and after they got back. But as we move into spring break, testing before and after is going to be important as well if people are leaving for periods of time from our community, especially as they come back into our community. So we want to strongly encourage people to continue to take advantage of the testing that is available in our community right now.
And then just a quick follow-up, thank you for that answer, by the way. As folks start to get vaccinated and we look ahead, we see those vaccination rates rising, the numbers coming down. I realize this is $1 million question, but at what point do we consider, I don't know, the pandemic is over? Are we looking at like a certain goal line for daily cases, hospitalizations, vaccination levels? What are y'all looking for?
Oh, that's a great question. And again, I'm not sure we have a concrete answer for that. We're looking for all of those things. Obviously, you've heard that for herd immunity, we're looking at anywhere from 70 to 85% of our community being vaccinated. I think we're a ways from that. Dr. Sullivan did mention that we're in the first part of group 4. All of group 4 is going to be eligible as of April 7th, unless the governor changes that date. And he announced this week that everyone should be able to get vaccines starting May 1, based on the additional vaccine that's going to be available. So the vaccine is one of the things that's really going to make a huge difference for us. But we also need to see our numbers come down. And as I said, we're watching what's happening in other places. The variants create some concerns right now. They seem to be responsive to the vaccines, but we'll need to watch that as well. So, it's hard. I don't know that we'll ever have a cut point in time where we say it's over. But I think there will come a time when we are much more comfortable than we are, and maybe are moving into more of a maintenance phase around this virus. Dr. Sullivan, you have anything to add to that?
Oh, I think you're exactly right. I think it'll be a while though. And even initially, even if we see our numbers go down further, we know how quickly they can come back up. And so I think the continued vigilance that you've stressed, we just need to continue to do that, especially as more and more people get vaccinated.
I guess the only other point that I'll add to is, as of this point in time, our children cannot be vaccinated. So it's going to be hard to say that this is over until we get to a point where we have a safe and effective vaccine for our children as well as adults. And we don't know what that timeline is at this point.
Next question is Hannah Smoot, Charlotte Observer.
Hi, Gibby. This is Hannah Smoot. Can you give me a quick update on weather-related cancellations? Which StarMed vaccination events have been canceled today? And also following up on that last point you made about the governor saying that North Carolina will be ready to make everyone eligible by May 1st. Will the county also be ready for that date?
So I'll take the first question, and then I'm going to see if Dr. Sullivan has specific information on StarMed. I believe we'll be ready. I mean, one of the things that we've been actively doing, and Dr. Sullivan spoke to that, I think, is we have been working with partners in the community to build their capacity to take more vaccine and to get it out. We're working with pharmacies. We're working with the pharmacies in Harris Teeter and Publix and other places where vaccine is usually given. I think as we move through April, we are going to see that those venues where vaccine is usually available in our community normally is going to be better prepared to be providing vaccine. And so we're just working right now to help prepare them to make sure that we are ready once we have that vaccine available to us. And obviously, both healthcare systems as well as the health department will continue to participate and do everything we can to make sure that it's readily available. That doesn't mean that everybody's going to have access on May 1. I want a level set. We'll still be probably working through appointments. Once we have more J&J, we may have more drive-through, more pop-up type events where appointments are not available. But I do think that that we are going to be prepared to take the additional vaccine as it comes. And Dr. Solomon, do you know about StarMed, what the plans are today?
Yeah, so what I can say is we had a community event that was scheduled for today that we postponed to next week because it was supposed to be outside in a parking lot. But we notified everyone who had already signed up and actually scheduled instead an indoor event. Bojangles, where we work with StarMed, is still occurring, again, because that is indoors. I do know that StarMed also received their an additional allocation and had opened up some appointments at Freedom Drive. I am not aware of any cancellations, but that would be the place that may be occurring.
Next question is Alison Kuznitz, Charlotte Observer.
Maybe it's Alison from the Charlotte Observer. So we're not really into spring break yet. So could you outline a little more what is causing our numbers to stabilize right now? And if we do kind of see the onset of the variants, how much differently would we see our cases rise compared to what we've seen previously? How would that affect the doubling rate, for example?
Our numbers have dropped significantly since January. I've compared the numbers, and the percentage decrease is pretty significant. And we're at one of the better places we've been since July at the moment. I do think that we have, part of that is, it's due to a lot of different things. Coming out of the holiday season, people have been paying close attention to the masking and the social distancing. But as things open up more and we're getting into spring and people are out and about more, we may be starting to see a stabilization in that improvement. We're just watching that very closely. And so I'm not sure exactly what we will anticipate moving forward. Some of the variants seem to be highly contagious, and at not knowing what all is happening in our community around variants at this point, we've been having conversations with the state and with others about the possibility of doing some more surveillance testing to see if we could get a better handle on that. But as those variants become more prevalent, we could potentially see numbers going back up. I'm hoping not, but we're doing everything we can, but we can only do so much. We can get the vaccine out. We can provide the guidance. We need the community to do the things that are going to help us keep those numbers down. The last thing we want to do is to have to backtrack. We don't want that to happen. We want things to continue to open up and be available, and we want people to be able to work, and we want children to be able to go to school. So we need everybody's help with this right now.
Next question is Chloe Leshner, WCNC.
Hi, thanks so much. You mentioned that 15% number for about where we're at with vaccines right now. Is that kind of where you expected to be at this point in time? And then what do you think needs to be done to get us higher up and closer to that herd immunity?
There has been some concern voiced because the state percentage is higher than our percentage in terms of the number of people vaccinated. And I think there's a couple of reasons for that. One is some of the large events that we've had in Mecklenburg County have drawn people from other areas. And so not all Mecklenburg County residents were being vaccinated in those settings. We've got a large population. Some of the populations that we've been working to vaccinate are more challenging to be vaccinated and to get and have access to the vaccine. So all of those things are things that we're working on. And the other thing that I will tell you is the state has changed their formula a little bit on how they're providing amounts of vaccines allocations to counties. And part of what they're taking into account is the percent of the population that's been vaccinated. So that's one of the reasons that we're starting to see more vaccine available in Mecklenburg County. I think we sort of hit the top of that list of counties that needed additional vaccine. So are we where we want to be? No, we'd like to be further along. We'd like to see more people vaccinated. But I think, as I mentioned earlier, we're dealing with disparities, access issues. We are continuing to deal with hesitancy issues as we move into group 4, even as we moved into group 3, but into group 4 and then into group 5. We'll be working to address all of those things as best we can. Just want to encourage the community. These are safe vaccines. These are effective vaccines. And we really want you to take advantage of this. And if you know, if the argument is, I'm young, I'm not going to get very sick, it doesn't really affect me, you need to be thinking about the people around you, whether that's children in our community, whether that's others who for some reason can't take the vaccine, or whether that's just the people that you may come in contact with that haven't had the chance to be vaccinated. You need to think about others. This isn't just about you at this point. It's about our entire community. So we ask that people think seriously about that and then go make an appointment and get a vaccine.
Next question is Caroline Hicks, WBTV.
Hi, thank you for taking my question. I know you mentioned that preparation is going to be key in working with your community partners to get everybody prepared for when there is a bigger supply of the vaccine in our area. Can you kind of talk about what does that look like? How do these pharmacies and other entities prepare?
I'm going to ask Dr. Sullivan to answer that question.
Yeah, so I think, the first step is as we've talked about, is our goal is, as vaccine comes into the county, to get it out as quickly and equitably as possible. And we know that very initially, the vaccine was largely coming to the health department and the 2 hospital systems. And I think we are very fortunate that we have seen a significant number of enrolled vaccine providers around the county. So the first step for providers is they do need to register with the state to become an enrolled provider and go through that entire process. And we often receive lots of questions and outreach from providers around the county, and are committed to continuing to provide support so individuals community clinics and pharmacies are able to do that. The second is, once they become an enrolled provider, I think a lot of what our learning at the very beginning when we receive vaccine around the storage and handling, around vaccine preparation, around scheduling appointments, the guidance, the required paperwork, it's really working through all of those. And so every time that we are notified of new enrolled providers, we are trying to do outreach to them to talk them through their readiness, what questions, concerns. We have providers that come and have spent time at some of our clinics to be able to learn that process so that they are then ready. And I think the third is, as we get vaccine supply, sometimes now as the state is determining who's receiving that initial supply. And so some of the enrolled providers are now receiving vaccine directly. But one of the challenges that we've talked about is, particularly with the Pfizer vaccine, it can only be shipped in quantities of 975 doses. And some of these smaller clinics or pharmacies can't receive that much in a week. And so we receive it and then can transfer out smaller quantities of that. And so it involves, again, working with them and making that plan. I think it's an incredibly important part of the work that we're doing. Every week, we're doing more and more of that, because as more vaccine supply comes in, it also allows us to get more vaccine to different places where people know, they trust, it's in their neighborhood. And I think that that's going to be such an important part of getting more people vaccinated.
Next question is Brett Jensen, WBT Radio.
Thanks. One of the things that I've ran into, and I don't know if it's going to be for Dr. Sullivan or Gibby or both, but is that a lot of people, and I've got this in abundance, where people are concerned or keep mentioning worried about the side effects that the vaccines are going to provide. I had my first one and nothing happened. Can you just talk about or maybe calm the fears that these people are talking about? They're worried about the side effects. That's one reason why they're hesitant to get this. They want to see what happens down the road before they get it. So can you either calm their fears or substantiate their fears?
Yep, I think that that's such an important question. I think one of the things that we really strive to make sure is that people have all of the information that they need and have all of their questions and concerns answered so that everybody feels comfortable when they receive the vaccine. So I think we do know, and this is true for every vaccine, that side effects can occur. As you just mentioned, they do not occur for everyone. Many people get the vaccine and have no side effects, and that is completely normal. And if somebody gets a vaccine and doesn't have has no reaction at all, they should still feel comfortable, because we have had people who are concerned that they don't have side effects. And we want to make sure to know that that's normal. But, post-vaccination symptoms, the most common of which is soreness in the arm where you receive the vaccine. But other post-vaccination symptoms or side effects, which can include feeling a little bit tired or achy, having a headache, potentially having a low-grade fever. Those are just signs of your immune system responding to the vaccine. And that is a normal part of the vaccination process. It is something that is expected. And I think something that people should be prepared for and understand, though, that that is not a sign of COVID. There is no live virus in the vaccine, so the vaccine does not cause COVID. It protects you against COVID. It protects you from getting sick. It protects you from spreading it to others. And I think that just understanding why you may or may not have side effects and that it's different for every person, but that it's a normal and expected part of the process is really important. What I would encourage people who are hesitant is to find reliable sources, including our website, including the state and CDC website, to read about it, to call our hotline with questions, to call their healthcare provider if they have one, someone that they know and trust, to really talk it through. And then make sure when they show up for their appointment that all of their questions are answered before they get it, and that they have a place that they can call afterwards, but to recognize that it is normal. But getting vaccine, as Gibby said, they're safe, they're effective, and they save lives.
Thank you, Dr. Sullivan. Floor is now open for follow-up questions.
Hi, this is Chloe with WCNC. Just wondering kind of where you are at with group 4. I know obviously you need supply to get to those people, but just how is it going so far? Have people been able to schedule appointments sometime soon in that group?
Yeah, I think we were really excited when Group 4 opened up yesterday. So we talked about it. One of the groups that is now eligible is individuals with high-risk medical conditions, and we know, right, that COVID. Everyone is always at risk for getting sick from COVID, but especially those that have higher risk conditions have been at higher risk throughout this. And I think the fact that they now have access to the vaccine is something that we have been really looking forward to. We definitely know that there's a big demand for appointments. We were able to open up a small number of appointments yesterday. Those quickly filled. But as we work with the state, as increased supply comes in, as we are able to transfer vaccine to other enrolled providers, we are confident that more and more appointments will become available. And so we work with our wait list and we work with our community partners to try and get people appointments as quickly as possible. I think still at this time, the demand for vaccine is larger than the supply that is in our county. And so we do recognize that there are people in Group 4 and potentially in earlier groups that still are unable to find appointments. We encourage them to continue to try to continue to reach out to us, and we will make as much information available as appointments become available.
Next question, please.
Hi, this is Vanessa again with WCNC Charlotte. I know in the past we talked about, not needing or not wanting to compare vaccines to each other, and really just the importance of getting the vaccine that's available to you when it's available to you. But I think another important thing to talk about is just why you can't compare the efficacy rates that we're seeing from these studies from one to the other. And I didn't know if you could elaborate on that and why, scientifically, really it's not possible to compare these.
Yeah, so I think there's two really important points there, and thank you for bringing that up, because I think I'll first just stress, right, we are incredibly excited. We have 3 safe and effective vaccines, and we are still continuing to encourage people to take the vaccine that is available to them, and we have very high confidence in all 3 of the vaccines, and the more people we get vaccinated, the less impact of COVID we'll see, and the more that we can continue to resume opening things up. So 2 important points about why we say we don't compare the vaccines with each other. The first one is, the vaccine data is really based on randomized controlled trials, which is a gold standard, meaning the best way that you can get data about how safe and effective a medication or a vaccine or an intervention is. So the only way that you can really effectively compare 2 different medications or 2 different vaccines is if you have a randomized controlled trial where some people are getting one vaccine and some people are getting the other, and that didn't happen here. The second thing that I think is really important is that when the Moderna and Pfizer trials happened, that was at a very different time frame in our pandemic as the Johnson & Johnson vaccine. So the Moderna and Pfizer vaccine happened kind of before we saw that really large peak and before we started to see a significant spread of many of these variants that we saw. And so understanding that they were tested at different times throughout the pandemic would also impact that data. So what I think is more important to look at is what is their effectiveness at preventing severe disease, hospitalization, and death. And based on the data that we have, all based on randomized controlled trials that they had versus placebo, they all are safe and effective. And we're encouraging individuals, again, to take the vaccine that's available to them.
Hi, this is Caroline Hicks with WBTV. I know you kind of touched on some weather cancellations, but I'm just curious, with the potential for severe weather, is that something that you're looking at in terms of having to change operations at Bojangles Coliseum, or would there be a plan in place if that were to ever happen in terms of how you would reschedule people and things like that?
Yeah, so fortunately, because the majority of our operation for Bojangles is indoor, we don't anticipate normally having to cancel or reschedule operations. There was a time several weeks ago where there was an active thunderstorm with lightning nearby that was occurring, and we do have individuals helping outside with traffic. Obviously, safety always comes first, and so I think we temporarily delayed individuals coming in until that had passed. And so I think we do consider certain weather, but because it's indoors, we're able to have much more flexibility. When we plan outdoor events, we typically try and have a backup weather plan when possible that we could move it indoors. But there are times, so for example, an event that we had planned tomorrow, which was all exclusively outdoors for today, that was all exclusively outdoors in a parking lot, and not knowing the weather, felt that it would be better to postpone again to take safety into consideration. So that's, I think, always thinking through, but hopeful that the weather cancellations are minimal.
Dr. Sullivan, that's Alison from the Observer. Can you talk about, have you seen any people who have been vaccinated contracting the virus, or maybe people kind of went out and about when they didn't have the full protection from the vaccine and then ended up contracting the virus?
Yeah, and I think that's a really important point that we talk about. We know the vaccines are safe and effective, and especially effective at preventing people from getting severe disease or needing to be hospitalized from the virus. But first, we absolutely know that no vaccine is 100%. And so this is why it is so important that anybody who gets vaccinated, especially before they've completed the full series, but even afterwards, needs to continue to adhere to those precautions. So we have seen instances of people who have received one dose and then tested positive. That has occurred multiple times, and even seen times of individuals who are fully vaccinated who do test positive. Those individuals that we have seen who are fully vaccinated and test positive, the overwhelming majority, in fact, I think all of them that I am aware of, were either asymptomatic or had minimal symptoms. So I think, again, it speaks to the vaccine's ability to prevent people from getting sick, which is so important. But that does not necessarily eliminate their ability to transmit the illness. And so I think while there are now some relaxed precautions for individuals who have been vaccinated, who may be able to spend time indoors, not masked with other fully vaccinated individuals. It is why, though, again, when we're out in public, still taking all of those precautions, because recognizing that there still would be a risk to transmitting to others, and we all have a responsibility to do whatever we can to prevent that as well.
Next question, please.
Vanessa again with WCNC Charlotte. Speaking of those breakthrough cases, I had seen in some news articles, people quoted as saying here, 95% efficacy means 5 out of 100 people could get COVID. To me, when I look at the definition of efficacy, it seems to me like maybe that number might actually be smaller because you're comparing it to a control group. I didn't know if you could elaborate on that.
Yeah, it's a bit of a complicated, I think that word is a little bit complicated. I think the best way to think it through is when you think about 95% from an individual getting vaccinated, to understand that that is a high number. And so it's really, the vaccine is good, right? It is effective. It really significantly reduces your risk of getting sick and kind of having severe disease, as I talked about, but it is not 100%. So I think rather than thinking through, is that 5 out of 100 or is it a little bit less, just understand that it's not 100%. So the risk is small, but it is not zero. And that's why it's so important to take precautions. I think the second thing that's also really important to understand is that 95%, again, really focuses on somebody getting symptoms or sick with COVID, does not focus on, going back to the previous question, someone's ability to spread the virus. And that's data that we are still learning about. I think we've had really promising data come out that say that vaccinated individuals are much less likely to spread, but that we have not put a 95% number or any number on that yet. So again, and I know I may sound a little bit like a broken record right now, but that's why when you're vaccinated, really important, should definitely feel that level of protection, should feel comfortable with that, and can adhere to some very mild reduced restrictions that the CDC has put in place, but by no means completely revert back to life pre-COVID, still adhere to masking, still limit non-essential travel, still limit really large gatherings, and obviously if you develop any symptoms, to immediately isolate and still consider getting evaluated.
Next question, please. Are there any further questions today? Last call for questions. All right, thank you, Dr. Sullivan. Thank you, Director Harris. Everybody have a safe and enjoyable afternoon.